My name's Rebecca Haffagee. I am the Acting Assistant Secretary for Planning and Evaluation and the Principal Deputy ASPE. I'd like to welcome everyone here to our inaugural HHS Equity Learning Series. We are so excited to be launching this series and to have you all joining us. To remind you, this is put on by the HHS Disparities Council, Health Disparities Council. This Health Disparities Council is a departmental coordinating and advisory body on health disparities and equity for racial and ethnic minorities and other underserved and marginalized populations. The council is co-chaired by the Assistant Secretary for Health, Dr. Levine, and the Assistant Secretary for Planning and Evaluation, of which I am the acting. This HHS Equity Learning Session is the first in what will be a bi-monthly series of events for HHS staff that highlights ongoing work throughout HHS that seeks to advance health equity. They are intended to provide opportunities for department-wide information sharing, learning, and discussion on equity, and all HHS employees are welcome and encouraged to attend. We will progress to a question and answer session, a section at the end of the agenda. And with that, you can email real-time questions directly to the studio. The email address is questions@hhs.tv. Again, questions@hhs.tv, using the subject line, equity learning questions. Then we will route those questions to the appropriate person and be able to hopefully have lots of time to field those and have a great discussion at the end. I would like to introduce Dr. Rachel Levine, the co-chair of the HHS Health Disparities Council, and also our 17th Assistant Secretary for Health. Dr. Levine is a pediatrician who specializes in adolescent medicine and eating disorders. She's been a professor of pediatrics and psychiatry at the Penn State College of Medicine, held various leadership positions at the Penn State Hershey Medical Center, most recently worked in the Pennsylvania state government as physician general and the acting secretary of health. And she also was president of the Association for State and Territorial Health Officials. We are so privileged to have Dr. Levine both helping us and leading this Health Disparities Council work and also as our ASH. Dr. Levine.
Well, thank you so much for that introduction, Rebecca. Good afternoon, everybody. Again, I am Dr. Rachel Levine, and I have the honor of serving as the Assistant Secretary for Health within the U.S. Department of Health and Human Services. It is also, as you mentioned, my pleasure to serve as co-chair of the Health and Human Service Health Disparities Council. Thank all of you for joining us today for the Council's inaugural Health and Human Service Equity Learning Session. These learning sessions are intended to provide opportunities for department-wide information sharing, learning, and discussion on equity, and all Health and Human Service employees are welcome and encouraged to attend. It's great to see everyone, although virtually in this virtual world we live in, and so many colleagues across Health and Human Services from many sectors, all working towards the same important goal of advancing health equity. At its core, health equity is defined as the attainment of the highest level of health for all people, regardless of race, ethnicity, sex, gender identity, sexual orientation, age, class, disability, nationality, religious beliefs, and language proficiency. Now, we have all faced a very difficult and challenging year. The COVID-19 pandemic has caused tremendous suffering for millions of Americans, and many of us have felt the strain. The fact is that this pandemic has affected some far more than others, and has also underscored the profound disparities in health that have long plagued our nation for far too long. At our department, it is our goal to ensure that we prevent such inequities in the future, and equity is a key part of the mission at Health and Human Services. As you know, the mission of the department is to enhance the health and well-being of all Americans by providing effective health and human services by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. In order to do that effectively, we must continue to work together collectively. And that is the goal of this inaugural bi-monthly equity learning session, to learn from others, foster conversations around equity in all of our work together. Well, now it is my great honor to introduce the 25th Secretary of Health and Human Services, Javier Becerra, the first Latino to hold the office in the history of the United States. As Secretary, he is carrying out President Biden's vision to build a healthy America, and his work focuses on ensuring that all Americans have health security and access to health care. Throughout his career, the Secretary has made it his priority to ensure that Americans have access to affordable health care that they need to survive and thrive. From his early days as a legal advocate representing individuals with mental illness, as a representative in the House of Representatives, and to his role as the Attorney General of the state of California. Secretary Becerra is committed to ensuring that everyone in our country has health and hope each and every day. And I am so honored to work with him on tackling these health equity issues. Secretary Becerra.
Dr. Levine, thank you for that introduction. And thank you to you and Dr. Haffajee for your work co-chairing the Health Disparities Council. To Rear Admiral Collins, big thanks to you for your leadership and the work you're doing leading the Office of Minority Health. And certainly to the Health Disparity Council, the members of it, thank you for putting this event together and for leaning forward when it comes to health equity. We must treat these learning sessions as a real priority. So good luck, and know that we are with you. The great challenge of our time is to make this country a more equitable country and a more just country, a country in which people from all backgrounds, all races, all national origins, and of all walks of life have the same shot at participating in our society in pursuit of their American dreams. This means giving people opportunity, optimism, equitable access to healthcare. This mission starts at the top, and President Biden isn't just giving us words, he's giving us deeds. He is walking his talk. And HHS has been given the power and resources as a result of that. In his short tenure, the president has expanded healthcare and reduced costs to address racial health disparities. He set up federally run community vaccine centers in hard-hit areas of our country. He has sent vaccines directly to local pharmacies and community health centers that disproportionately serve vulnerable populations. And through his budget, which from my perspective is the sum, in its sum, a reflection of our values, he has made it very clear in that budget that equity is central to the work at HHS. To me, equity is more than numbers though, and it's more than about a balancing act. It's personal to me. I remember my dad's stories of not being allowed to enter establishments and restaurants because of his race, national origin. I remember my mother being rushed to the hospital because of a health scare. I remember the peace of mind that we had because we had access to quality health care, because my father, as a union member, a construction worker, got coverage through his union, and he got health insurance when many other people earning his kind of income couldn't. So to me, it's not enough that we see some people treat laborers with a 6th grade education with little respect. To me, it's not enough to say that we have to improve. To me, this is very personal, and we have to do better. And I'm sure to you, it's personal as well. The past few weeks, very personal. It's been difficult on a lot of us. We can't overlook the anxiety, the stress, the trauma that reliving events like George Floyd's last moments of life, that forces on all of us and all of our communities. And while yesterday's verdict in the trial of Derek Chauvin for the murder of George Floyd provides us with some level of accountability on the road towards justice, it does not change an egregious wrong that did occur. The Biden-Harris administration and I, as Secretary of HHS, lock arms with all of you in this struggle for justice and equity. Justice and equity must be a part of everything we live and we do. And I am here to tell you that justice and equity will be part of everything that HHS does. I am thrilled to join you at this inaugural Equity Learning Series, session because it shows that thanks to all of you, HHS is thinking and leaning forward. And we're thinking and leaning forward on equity because that's what we should do. I challenge each and every one of you to continue to think and lean forward as you do your work. And I ask you to always remember to keep justice and equity in mind. Thank you and enjoy and learn from these sessions.
Thank you so very much, Secretary Becerra, for those remarks. We are so grateful and appreciative of you joining us today. Hello, my name is Rear Admiral Felicia Collins, and I am the Deputy Assistant Secretary for Minority Health and the Director of the HHS Office of Minority Health. And I am delighted to introduce our next presenter. But before I do so, I want to remind everyone again that if you have a question throughout the session, including for our next presenter, please send those questions to questions@hhs.tv. That's questions@hhs.tv, and you can send them at any time during the session. We will answer as many questions as we can during our question and answer section as our time allows. And if you include your email address, we will try to follow up after the session if we don't get to your question during the session. Again, the email address for questions is questions@hhs.tv. And now it is my pleasure to introduce to you Dr. LaShawn McIver. Dr. McIver is the Director of the Office of Minority Health at CMS and is the Principal Advisor to the agency on the needs of minority populations. Prior to CMS, Dr. McIver led governmental affairs and advocacy at the American Diabetes Association as its Vice President of Public Policy and Strategic Alliances, and later as its Senior Vice President of All Governmental Affairs and Advocacy, providing direction on the American Diabetes Association's advocacy activities focused on research, eliminating disparities, prevention, and improving the availability of healthcare. Dr. McIver earned a medical degree in international health and medicine through the Medical School for International Health in collaboration with Columbia University's Medical Center, and a master's degree of public health from the Johns Hopkins University Bloomberg School of Public Health. Dr. McIver, thank you so much for joining us today.
Thank you so much. So good afternoon, everyone, and good morning for those who may be joining us from the West Coast. I'd like to say a special thank you to Secretary Becerra, Dr. Levine, and Dr. Haffajee, and to Rear Admiral Collins for setting the tone for today. As stated, my name is Dr. LaShawn McIver, and I'm delighted to share with you all what we're doing at CMS to embed health equity into our programs and policies. When I came on board last August as the new director for the CMS Office of Minority Health, it was really important for me to understand the current state of health equity work within the agency as I began to look to the future for strategies of our office. As the largest payer of healthcare in the U.S., I believe our agency plays a vitally important role in driving equity in the healthcare system. And in order to effectively do this, I also realized that our office would need to be collaborative, we would need to be strategic, intentional, and systematic in our approach to getting there. So for this first Health Equity Learning Series presentation, I will be sharing with you the process I used to conduct our health equity inventory, provide an overview of what we are still learning as a result of this inventory, and what efforts have started as a result of this work. I have had outreach from across the department on how we're building CMS's health equity infrastructure. So I hope this information today will be helpful to others as you're looking for ways to facilitate a whole government approach to advancing equity. The last thing I would like to say before I get started is a special thank you to the OMH team for all their hard work in contributing to this process, and to our Deputy Captain Wanda Finch, who's played a critical role in this work and is currently deployed on a COVID-related mission. So we are seeing daily the benefits of these countless hours, and I'm excited to share with you today where we are in the process. So with that, I'm going to share my slides. Okay. All right. So to get started, what I have found useful as we've done this work is making sure folks understand what it is that our office is within the agency, what is our function within the agency. So our office serves as the principal advisor to the administrator and the coordinator and integrator for all minority health issues at CMS. Dr. Levine mentioned the populations that we focus on, and likewise within CMS, of course, we focus on those same populations. And our office is there to provide leadership, vision, and direction related to improving minority health and eliminating health disparities. We also lead the development of the agency-wide data collection infrastructure for minority health activities and initiatives and monitor the impact on agency programs. We participate in the formulation of CMS's goals, policies, legislative proposals, priorities, and other strategies that involve the work that we're looking to impact. In addition, we consult with the HHS division and other public and private agencies and organizations to collaborate in addressing health equity. And I just have here in this bottom corner, we work as an office to help drive and coordinate activities related to the implementation of many of the executive orders that have come through recently related to health equity. In these next few moments, I'll be sharing with you the process that we've undergone in these last couple of months to assess where we are as an agency related to health equity, and to really identify how do we start building pathways and bridges forward so that we can be effective in this work. I will start with an overview of our health equity inventory. This work actually began last fall. As noted, I came in August of last year, and as you can imagine, at the height of, as we were really deeply impacted by the pandemic, I came in August. And so as I started, we knew that this would be important to conduct this environmental scan. And so what we began were a series of listening sessions with the leadership within CMS and leadership teams across CMS. And we met with all 24 of our offices and centers. And these initial conversations really were about exploring what are we currently doing as an agency, connecting and building those bridges that are always necessary when you're addressing health equity issues, and assessing what are the areas of opportunity. So these were conversations that we began in October, and they went on through January of 2020. But partway through that process, we realized that we needed some type of tool or way to look across the entire agency and be able to leverage the work that's happening and to do it in an impactful, coordinated way. So the first week of January, we launched our health equity inventory, and I'll go into more details about the information that we collected, but this was the impetus for the health equity inventory. For CMS, this was our first ever state of the agency health equity inventory, and we were able to conduct it by collaborating with our teams across the agency. And we, as I said, we did all 24 centers, and our office, of course, was the 25th center. What happened at the same time as this was, as we were undergoing this process, we saw one of the first executive orders that were released under the administration related to advancing equity in underserved communities. And we saw this as a great way to leverage this assessment of existing programs and policies to identify system barriers to healthcare for underserved populations. So this is the overview, and I will now go into some additional details. We had several goals as we started this process. As I mentioned, one was to inform the responses to the executive orders on health equity, which came later in the process, but as we began to collect this information, recognizing it would be important to help inform our activities. Secondly, we wanted these findings to inform the development of a comprehensive shared agency health equity plan. So to date, CMS, Office of Minority Health, we have a health equity plan that focuses specifically on Medicare. But as we went through refreshing that plan last year and really beginning to look at where do we go in these next few years related to our work within the agency, it became very clear with our stakeholder, internal and external input, that a whole agency approach would be needed to address health equity. In addition, we wanted to use these findings to accelerate and expand collaborations and alignment across the agency to embed health equity in our policies, regulations, and programs. And the word accelerate is important because we recognize that in order to be impactful and also responsive to what was happening in the changing environment, that we needed to figure out how can we leverage this information to go as fast as we can to move this forward, but do it in a deliberate, systematic, and intentional way. In addition, we wanted to use these findings to better equip CMS to develop policies and programs that deliver resources and benefits equitably to all. And when I say better equipped, you'll see as I talk about some of the results that there's a lot of wonderful work that's happening. And through our initial conversations with leadership, we learned of some of the gaps that we felt as an office would be important for us to help fill so that we would be prepared, more prepared to do this work across the agency holistically. So how did we conduct, or how did we execute on this inventory? So we provided the inventory to all of our components as noted, and we asked each component to provide an overview of the activities that they're doing to advance equity. This was an important part of the exercise because we were learning through our leadership meetings and interviews that there was work that we learned of through this process, but there were other things that our team was engaged on that really didn't come to the surface as we were doing this work. So we wanted to make sure we had a full view of this. So it was a very detailed process of what type of information we were gathering across the agency. Also, we asked each component to talk about the challenges that they've encountered while engaging in health equity activities. We had heard that there were some challenges for components trying to think through what is the best role for them to address health equity, given the resources and what they functionally do within the agency. From those conversations initially, we learned that although there were challenges, there were also some key lessons that people were learning to engage in health equity activities. So we wanted to capture that more holistically as well. We also wanted to find out what were opportunities to engage with CMS OMH on our health equity work. A lot of the components didn't realize that we had a health equity TA assistance program, wherein for some parts of the agency we've worked closely with for a number of years, but this resource is something that is available to every component within CMS and allows us the opportunity to work on to work on health equity holistically across the agency and to provide that expertise on the many different things that we're doing as an agency. And then lastly, we wanted to find out, were there additional stakeholders that we needed to engage as we followed through on this work? So our initial findings. We were very pleased that we had a robust response from the agency. We received nearly 100% participation, and we found that about 14 of our components are doing health equity work. And it varied, the type of work that was being done across the agency. It varied greatly based on the function and role of that component within CMS. We found that 10 components said that they didn't have any current health equity activities. And what was interesting about that finding is, although in the current state, people didn't have things that they indicated that they were doing, we learned through the partnership building activities that have been happening over the last couple of months that there are ways that even components that have not traditionally worked on health equity issues, there are ways for them to impact health equity. And so bringing these pieces together is very important. In terms of an overview of what we found is happening, we are doing a lot on data collection related to health equity, data collection, management, analysis. technical assistance provided by our office, as well as other parts of the agencies working with external stakeholders, quality measurement. We're doing a lot in that space relative to health equity, value-based and innovative payment models, language access initiatives, rural health initiatives, outreach, and education. On this slide, I just want to provide an overview and at a glance. So this is not a holistic list of everything that's happening, but just to give you an idea of the types of activities that are happening across CMS. So I talked about we have different technical assistance bodies across the agency. We have think tanks that are working on this. We have different types of work groups and programs that are looking at how do we drive equity within healthcare. So quite an extensive list of work. In working and talking with the leadership across CMS on these areas and these issues that we're focused on as an agency, it became clear that there's some groups that have deeper levels of engagement on this, and some wherein they're doing work, but it's not as high a priority as it is in other parts of the agency. And so this was an important snapshot for us to understand this cross-section in time of where we are as an agency, given we're being asked through many of the recent executive orders to think about how do we accelerate embedding health equity into the work of the federal government. And this is the whole government approach. And so all of us, of course, have some role in executing on that and really thinking critically about the work that we're doing and how it's impacting underserved populations. In addition to the great work that we learned that's occurring in the agency, we also found out that there are areas that we can improve in. And so when we completed the inventory, we realized that there were some duplicative efforts happening across the agency, that there could be some efficiencies gained from a resource perspective if we work more collaboratively as an agency and more focused. We also realized that there's a lack of an overarching CMS-wide health equity strategy. And that's important because, as I noted earlier, we are a major player in the healthcare system, and it is important for our agency to deliver equitable access to healthcare to all of our beneficiaries. And so doing it in a coordinated and strategic way will be very important for us to make a difference in the lives of those who have been disproportionately impacted by many different things. So this was something that we learned. And although we had an office level plan, this plan, as I said, focused on Medicare only versus something that would look at all of our programs strategically and cohesively. I mentioned that our office, one of our functions is to help coordinate this type of work across the agency. And we found that there's a lack of coordination currently in our current state of how we're addressing health equity. And so we found that it's not just across the agency, but also within some of the components that there's a lack of coordination of this work. This analysis has allowed us to identify some of the key challenges and knowledge gaps that could be addressed through improved collaboration and CMS-wide coordination. So in looking at these bottom areas here, data collection is a strength of us, for our agency, data collection, reporting, and analysis, but also it's one of the areas where we have many challenges that we're working to overcome so that we can have complete data as we're looking at the needs of different underserved populations. So this was something that we are doing a lot of work in, but we also recognize is a barrier for doing this work effectively. Standardization of terminology. So I think it was Dr. Levine that started with some definitions on what does all of these things mean. I would say taking a whole government approach to equity is an exciting opportunity to address equity. In the same notion, ensuring that people have the information and the tools that they need to do it successfully and effectively is important. And words matter. So making sure that even as an agency, we're working from the same knowledge base of what do these things mean, how are we using it in our programs and policies across the agency. So that was something that we found as a result of the report of the inventory. Stakeholder engagement. We are doing, in some areas, we're doing great engaging our stakeholders. But one thing I've learned from years of working in the patient advocacy space previously is there is a saying people use, nothing about us without us. And when it comes to policy, these policies touch people where they are in their communities. And so as an agency, wherever we are within the department, making sure that we're actively, deliberately, and intentionally engaging stakeholders to help inform the work that we're doing is critically important. And so we recognize that there are some areas of improvement that we need from a stakeholder engagement perspective. Then also we found that statutory and regulatory requirements present a unique challenge and opportunity for us, in that we have to work within certain requirements. And so we have to think, creatively, innovative, and innovate in how we leverage what we're able to do. What are the tools that we have as a rulemaking body to effectively do this work? And then lastly, realizing that embedding health equity throughout the agency is not an easy thing to do, but if we do it together, realizing we can get a lot done and impact people in a meaningful way. And so this challenge of what does it actually mean to embed health equity into what we do, and how do we do it? I think this came through in our inventory as a challenge of really trying to understand how we will achieve that. So on this last slide, in the next few moments, I'll quickly go through moving from analysis to action. So what are we doing now that we have all of this information about what is happening within our agency? We're looking to release a report next month that will be used as a tool for the agency to think about how do we strategize collectively to address this. So we are working to finalize this so that this information will be available. We're hoping that others will learn lessons from what is happening in other parts of the agency, so that they can think through what are their possibilities. We are starting a CMS Health Equity Learning Series as well to engage our offices and centers. So, as I noted, some of the leadership expressed that there's a need for our staff to understand this health equity in a more deliberate way, so that we can be effective in the things that we do as an agency. We've established a CMS Advisory Council on Equity to coordinate across the enterprise how we're implementing all of these great things that are happening across the department related to equity and specific to CMS, and to provide support and strategy for our leadership. We're working on rebuilding trust with stakeholders in our commitment to equity through a series of roundtables and targeted stakeholder engagements. So for example, next week on April 27th, we will be having our series, or a forum on addressing barriers in the racial barriers in the healthcare system. So April 27th and 28th, we'll be hosting Addressing Structural Racism in Healthcare. And that is a part of starting these conversations that are so necessary to driving forward this work. Also, we're developing a dashboard to track the health equity activities and outcomes. This inventory is a starting place. There are many different pieces of this that we still have ahead, and we want to be able to track how we're doing as an agency on delivering these things. And then lastly, we're hoping to use this experience to create a health equity scorecard that aligns component and enterprise equity goals and measures our performance in this area. So I will stop sharing my slide now, and I'll end by saying, thank you all for giving me this opportunity to share what we're doing at CMS to drive health equity. It has resulted in some incredible conversations as we have engaged with likely partners and unlikely partners in our agency in health equity. And so I'm very thankful to be one of the first speakers for the Health Equity Series, and I'm happy to answer any questions that you might have. Thank you.
So thank you so much, Dr. McIver. That was awesome, and a great way to get us started in our efforts to bring the entire department together to talk about health equity. I have the pleasure of moderating the question and answer period, and I'll start by saying I am just so excited by the number of questions that have come in. They are far more than we can handle during our time today. And so we'll have to go back and figure out a way that we can maybe address these through the intranet or something. But the number of questions and the content is a clear demonstration of the enthusiasm, the critical thinking, the desire to do things big and bold, as the secretary would say. And so that just in and of itself just warms my heart. But with the time we have, let's get to a few of the questions. So the first question is for Dr. McIver. Given what you've learned from conducting the inventory of activities, what would you characterize as the biggest opportunities for CMS in embedding equity over the next year or so?
That's a great question. I would say there are probably about 3 things that would be important. And one is, I talked in the beginning about being strategic and intentional in how we embed equity into CMS's programs and policies. As a rulemaking agency, that is one of the major ways that we can impact equity. But we have to be deliberate as an agency in how we embed equity into that process. So currently, our team is involved, and their team's working on this across the agency. But from an OMH perspective, we're sometimes brought in too late in that conversation at the pace at which things are moving through the agency. And so leveraging, thinking through how do we strategically and intentionally engage in conversations earlier on so that we can provide that strategic insight and guidance and leadership on issues, so that as it goes through the process, it becomes one of a refinement versus one in which we'll have little impact on how that would be impacted. So through the conversations that we've been having and what we're learning through the health equity inventory process, we are learning where we need to be, when we need to be, and what we need to bring to the table to help our components get this done. The other thing that I'll say is leveraging our TA capacity. So our TA capabilities is one way that I think one of the opportunities that I think will be helpful, because everyone in the agency is on a continuum of health equity. As I said, there's some that are doing this work, some that are not doing this work, and there's this middle part of our agency where there's a desire to do competing strategy, priorities and things, but bringing to the table that one, we're meeting everyone where they are, and we're bringing technical assistance to help whatever the request is or whatever the actions we're undertaking, helping us to get there. So I think by, as I said, leveraging how we can impact the rulemaking process, also providing that assistance and the technical assistance that will be needed to do this, that we'll be able to make some significant changes. And we're already seeing things move at a faster pace as our health equity TA requests are going up daily. So that's something I'm really excited about.
So in your response, you actually answered another question. And so I'm just going to echo it, because I think what you said in the list actually applies to us with the Disparities Council, because the question was, what happened to those components that are not really focused on health equity now, and how will they get up to speed? And so one of the efforts for doing that are these learning sessions like we're doing right now, so that we can have a common sense of understanding of definitions. We're working on an intranet page and other information. We'll be working with the operating division and staff division heads. So more to come, but fear not, because we do believe that there is a role for everyone, regardless of what your past experience is. If you're interested and see the importance of this work, which we know you do, there's plenty of room for you to join us. Another question now for Dr. McIver. You've had extensive experience in public health, and given that, what, if anything, is different about this moment? How will CMS OMH lead CMS in capitalizing on what's different in this moment?
Wow, that's another great question. So what I think is different about this moment, and I've been in public health now for almost 2 decades. What is different about this moment is COVID. COVID has made health, it has created a space where people are having a visceral experience of what these things mean for our country. We are seeing it in a different way. We're experiencing health disparities in a different way, on a different scale that I don't think a lot of people in this generation may have experienced to some degree. And so it's allowing for a different type of conversation, a different type of partnership in health equity. And I said this in my presentation that you can't do this work alone. And so you have to work with people who are working across these different areas to address health equity. In terms of how CMS can leverage this moment, I think we too we're feeling what just happened as an agency. I came on in August, and I've told folks that I've done this for a number of years. I've never worked this hard in my life trying to, getting this mission across the goal, and that we have all been working hard trying to help overcome the barriers so that the healthcare system can respond to what is happening in communities all over this country. And so leveraging this moment to look and think critically, what can we do to facilitate equitable access to healthcare and build this infrastructure? This is our moment to do something different and to think in new ways about how we accomplish this and leverage the tools that we have as an agency in the healthcare system.
Great, thank you. The next question is for Dr. Levine. And the question is, well, thank you for coordinating the Equity Learning Series. When it comes to health equity, what will be the focus for these learning sessions, and what is the population that you're focused on?
Well, thank you for that question. The focus of the equity learning sessions will be new, promising, and best practices for reducing health disparities, advancing equity within all of us at Health and Human Services and our whole Health and Human Services family. We are interested in your recommendations. So if you have a specific recommendation on a topic, when you complete the electronic evaluation for the session, please share that, because we'd be interested to know what you all want to hear about. In terms of the populations of focus of this series, but as well as about the broader Health Equity Disparities Council, it is really the populations defined by the President's executive order. It's people of color, and other underserved and marginalized populations. The executive order was advancing racial equity and support for underserved communities through the federal government. Stay tuned for more information, and we'll post that on our HHS intranet site for equity.
Thank you, Dr. Levine. So this question is for Dr. Havergy. Will the sessions be archived?
That's an easy one. Yes, they will be. We're recording them, and we'll post them on our HHS intranet website for equity, along with ongoing kind of resources and hopefully, as Dr. Collins said, additional answers to questions that we don't get to. So it'll start to be a repository for all these resources.
Okay, and then a second question for you. I have an extramural colleague that would be very interested in listening in and perhaps attending these talks in the future. Would it be possible to extend the invitation to colleagues outside of HHS in the future?
It's a good question. We're really happy to share our equity work and what we're doing across the department with external colleagues. I think we just have to think about appropriate vehicles. Sometimes what's shared in these equity learning series presentations will be specific to HHS, and the context will need to stay within HHS. So we might not be able to extend the invitations to these sessions to external collaborators and colleagues, but we are willing to explore other mechanisms for sharing for sure. And we want to let it be known what we're doing within HHS. So we'll continue to think about that. And if you have more information about what types of information you want to share and who those interested parties might be, please actually include that in your electronic evaluations. And then we can take that into consideration and think about the best ways to share this information.
Okay, thank you. Now I'm going through some more of the questions in the chat. Just a moment. So here's a question back to CMS. And the question is, what are the key ways CMS can deliver an equitable pandemic response to marginalized communities in the future, beyond things like vaccine rollout?
So that's a wonderful question. You know, there are things that we're learning during this current pandemic, and actually, as we did our conversations that we had with leadership earlier, the end of last year and into this year, our emergency response team, that whole, there was a conversation we had about what happens next and how do we expand our capabilities to be responsive to the needs of underserved populations. And so I think what I would say to that is there's more to come on what will emerge from CMS on that front, but more importantly, the dialogue has begun, and it was initiated because we are engaging in this type of outreach. You know, we have done some incredible things to help during the pandemic as an agency, and in talking to people who have worked at CMS for a number of years, there were some moments that, you know, people had never done things at the pace that they did, and you know, just some of the levels of engagement that was needed to address these emerging issues. But we worked together as an agency in a different way to respond to this type of emergency. And so I'm excited to see what will emerge from our future discussions on that, but it's certainly something we are exploring on how do we build out and execute on this as, you know, in the future for any type of an unfortunate, but probably inevitable future emergencies.
And then another question for CMS. So many of the biggest things that impact minority health go beyond a lack of traditional medical services. Things like poverty, housing instability, and other social determinants of health that are largely shaped by policies outside of the health sphere. What leeway does CMS have to influence policies upstream that contribute to minority health equity when those policies seem to fall outside of the traditional sphere of health services?
So CMS has done a lot of work across the agency looking for ways to address the social determinants of health in our policies. And so we have, you know, we've looked at it in the quality space. We've looked at it through the work of our innovation center. There are ways for us as an agency to impact these things, but what you're speaking to is that broader partnership that's needed to address the social determinants of health. There is a role for an agency that's focused on paying for healthcare to influence that work, but there are other partners that will be needed for us to fully address what the social determinants truly mean for populations. And so Secretary Becerra earlier talked about, you know, this equity and justice and all of the pieces to this puzzle of what determines one's health outcomes. It's bigger than just what we can do as one agency, but we have a role to play. You know, yesterday, my daughter and I heard a quote that said no one person can do everything, but everyone can do something. So I take that as not one single agency can achieve what equity means for all of these populations. Think about the millions of people we all are impacting, but every agency can do something to address what we're seeing as a nation. And this is our moment to do that. So it's that ability to think creatively and to think, how do we collectively as a federal government work together to get there?
And
So,
excuse me, if I could just chime in there, I do believe there
please.
is a social determinants of health working group as well that is actually co-chaired by ASPE and CMS, and maybe talk about establishing a council as well. So this is another example of the intersectionality of the different streams of work and how we can bring this under the or in collaboration with the Health Disparities Council as well. But I think this greater recognition of what we do in HHS goes beyond health and even health care, and that health care is only but one determinant of health outcomes. And so we need to really be thinking much more broadly and further upstream. And I think that's very consistent with the administration's priorities as well.
So I would actually like to chime in on that one as well. It's a popular question. I mean, I think all of those aspects of the social determinants of health really gets to that we need health in all policies, right? We need health to be considered by every department in the administration. I just came earlier from the climate task force, and every agency, every department is represented on that. And I think that that's true in turn when we talk about health equity and particularly the social determinants. So I think that we're very fortunate to be working in the Biden administration, because I think the president gets that. And I think that if you look at the policies through the legislative plans, the Recovery Act and the jobs program and other programs that are in Congress, I mean, they really get to every single aspect of the social determinants, which will impact health of the population and the health of all of us, and will have a positive impact with that.
So thank you so much to our discussants during the question and answer session. Again, I want to thank all of you that are participating with us today, because we got so many questions. We received so many questions, and so we have our work ahead of us to go back and to be able to answer them. But again, your questions indicate your interest, your enthusiasm, your desire to work and partner with us. And so that puts us in a wonderful position going forward as a department, as we, in some ways will be leading the way for the nation with regard to working to advance health equity. I want to close by, again, thanking you for joining us, thanking our speakers, Secretary Becerra, Dr. Levine, Dr. Havergy, and of course our presenter, Dr. McIver. What is clear from today's session, again, is that our work on equity within the department and with our partners actually impacts every corner of the nation. And we have a lot to do, but now is the moment for doing things bigger beyond what we have thought about in the past. And so we're embracing that moment, and we thank you for joining us and embracing it with us. We want you to mark your calendar for our next equity learning session, which is scheduled for June 16th at 2 p.m. Eastern Standard Time. And this session will include a presentation from the Assistant Secretary for Financial Resources Grants Policy Office. And the topic will be grants authorities that support equity. So we hope you will be able to join us then. And then for our last thing, you've heard some mention about the electronic evaluation form, and we really want to encourage you to take a few moments, and we're actually hopefully going to end a few minutes early so that you can actually complete the evaluation form. You can access the evaluation by clicking on the link to the right of the video that you're watching on the live stream website, or you can scan the QR code on the screen using your camera app on your cell phone. It is so important that we learn from you and understand what is helpful, what you'd like to hear about in the future. So please take a moment to complete the session evaluation. And with that, I'm going to say thank you for your evaluation, thank you for your participation, and have a great rest of your day. Thank you.